So, before starting the pathogenesis, we should know the risk factors which lead to the development of this condition, and you can easily memorize the risk factors by the mnemonic 4Fs. Just look at this picture and you are never going to forget the risk factors. So, the risk factors which cause gallbladder stones are female gender, fatty, fertile, and 40. So, female gender, obese patient who is in the reproductive age group and ranging from 40 to 50 years, they will be more predisposed to development of gallbladder stones. So, these are the risk factors which will contribute to the development of cholelithiasis. Now we will discuss the protective factors. So when there are risk factors, there are also protective factors which we can adopt to prevent ourselves from developing this condition. And the first is exercise. So whenever you are having exercise, your body fats are burning, so you will be protected. Next, research has shown that coffee is having a protective role as well. So this is also surprising that coffee is beneficial. And again, there is another dietary factor which is vitamin C. So when you eat vitamin C rich fruits and diet, you will also get an additional benefit. And lastly, there are drugs which are statins, and these are the cholesterol lowering drugs, so they will also help you. So if you are having exercise, you are having vitamin C diet, coffee and statins for lowering your lipids, you will be having protection against development of gallstones. So these were the protective factors. Now let us see the type of stones, and you should keep in mind that there are basically two types. One is cholesterol stones and next is pigment stones. So as the name is indicating, the cholesterol stones, they contain only cholesterol. Their composition is only cholesterol, whereas pigment stones, they will contain cholesterol plus bile pigments. There will be bile acids, bile salts, calcium salts. Certain pigments will be included in addition to cholesterol. So that's why they are called as pigment stones. So these were the two varieties of cholesterol and pigment stones. Now we will see the pathogenesis, that how these stones are formed in a normal gallbladder. So we have seen that liver produces bile which goes into the gallbladder for storage. And what happens that actually there is either increase in the cholesterol secretion or there is impaired gallbladder emptying or there is decreased bile salt secretion. So this might seem quite difficult to you. So to make it simple, we will see that basically cholesterol is kept in solution by bile salts. So there are bile salts which are having the effective role in solubilizing cholesterol and preventing it from precipitating. But whenever there is increased cholesterol secretion due to obesity, due to old age, or there is decreased bile salt secretion, so what will happen? The balance is going to be disturbed, and this balance disturbance will lead to supersaturated bile. Now the bile is having excess cholesterol and less of the salts which are required to keep it solubilized. So this supersaturated bile will become lithogenic, that is stone forming. And what will happen? That the cholesterol or the pigments, they will precipitate and this will lead to stone formation. So this is the whole role of imbalance of cholesterol and bile salts that is going to create stones in the gallbladder. So this was the pathogenesis. Now we will look for the clinical features, that when a patient present, what features, what sign and symptoms we will expect. But important to note is that 80% of the patients, they will be asymptomatic. So it is quite surprising that out of all, 80% of the patients are having no symptoms and they will require no treatment. But what about the others? They will have the symptoms. For example, first is the cholestatic jaundice. Now what is jaundice? We know that it is the yellowish discoloration of skin and sclera. And what is cholestasis? Cholestasis means there is stasis in the bile flow. So let me tell you this term, cholestatic jaundice, what does it mean? What happens that bile is the route by which bilirubin compound is excreted out from the body. But whenever there is stone formation, the bile flow will be obstructed. So when the bile flow is going to be obstructed, the bilirubin is not going to be removed from the body, and that bilirubin is going to cause jaundice. So the patient will develop dark coloration, yellow discoloration of the skin and sclera, and it will also cause pale stools and dark urine. This is the feature of cholestasis. So cholestatic jaundice is an important feature, and it will point out that there is obstruction in the drainage of bile. Now next is biliary colic, that the patient, as we have seen in this scenario, will present with right upper quadrant pain. There is some inflammation, so the patient is going to have pain and he will present to us with this symptom. Next is pancreatitis. So we have seen in the mechanism that pancreas was also situated closely in association with the gallbladder ducts, and the duct from pancreas was also opening into the duodenum. So if there is a stone and it has dislodged from the gallbladder and it has come up to the site of pancreas, it will also affect pancreas and it will cause inflammation over there. So pancreatitis is also an important feature, and we have to rule out this. This is very important. You should always keep in mind that the major cause of pancreatitis is gallstones. Next is CA gallbladder. So carcinoma of gallbladder is very rare, but 90% cases of CA gallbladder will have association with the gallstones. So gallstones, they predispose the patient to the risk of carcinoma development. So this is a rare presentation, but it is due to gallstones. Next is biliary peritonitis. Now you will be thinking that how gallstones are going to cause peritonitis, but it is very simple. Let me tell you that if the gallbladder, it is having stones and the patient has not got the treatment, the gallbladder can develop perforation. And when there is perforation of gallbladder, all the bile and all the contents, they are going to leak up in the peritoneal cavity and they will cause peritonitis, and this is a very severe and life-threatening condition. So this is again a complication of gallstones. So you see how they can cause biliary peritonitis when there is perforation of gallbladder. Next is small bowel obstruction. Now this again sounds very strange, that how the stones in gallbladder will cause small bowel obstruction. But it will be very simple if you will just pick this, that a larger stone that has dislodged from the gallbladder and it has been caught up at the ileocecal valve, then it can lead to gallstone ileus. It can cause small bowel obstruction. So these were the symptoms, and you should remember that most of the patients are going to be asymptomatic and the rest will have jaundice, colic or pancreatitis, and rarely they can present with carcinoma, or if they are complicated cases they can present with peritonitis and the small bowel obstruction. So now we will go for investigations. So once you have made a provisional diagnosis of gallstones, you will go for investigations, and for that we will start from blood test. And the first and the simple is complete blood count. But what do you want to look in this test? We will see the TLC count, and if the WBC is raised, then it means there is some infection behind. Next are the LFTs. You have seen the association of liver and gallbladder, so the transaminases, the liver enzymes, they are also raised, so you have to look for them also. Next is the amylase. You might be thinking, what is the role of amylase? We are studying here gallbladder, and amylase is related to pancreas. No, just remember what I told you in the clinical features, that the most important and the common cause of pancreatitis is gallstones. So never miss to rule out pancreatitis whenever you are having any patient presenting with right upper quadrant pain or epigastric pain, because symptoms, they are quite similar, and pancreatitis is a very life-threatening condition. So these are the blood tests, and next are the imaging modalities, and first and the simple modality is ultrasonography, and you will know that this is the method of choice to detect the gallstones, and this is the simplest method by which you can detect the gallstones. So if you are not able to see them, if their stone has lodged in some ducts, then we will need some more advanced technologies, and they are MRCP, that will provide you more detailing, or ERCP. ERCP is endoscopic retrograde cholangiopancreatography, and this is diagnostic as well as therapeutic, particularly for the stones which are in the CBD. So you can visualize them and you can remove them at the same time. This is the advantage of this technique. So ultrasonography, MRCP and ERCP, these are the imaging methods. Now we will see the management. And you have seen that most of the patients are asymptomatic and they will not require any treatment. But the patients who are having symptoms repeatedly or who have developed complications, they will require management. Management can further be of two types, which is conservative and surgical. So the patients who are having milder symptoms, they can be managed conservatively, and those with complications or repeated attacks will require surgery. Conservative management will include making patient NPO, and you can give NG aspiration. If the patient is having a lot of vomiting, you will provide analgesics to relieve the pain of the biliary colic, and ultimately you will give antibiotics, and cephalosporins are the preferred antibiotics. So this will relieve the patient who is having mild symptoms. But if the patient is having severe disease, you will have to go for open or laparoscopic cholecystectomy, which will involve the removal of gallbladder. And laparoscopic cholecystectomy obviously is more advanced, having more advantages as well, and is preferred over open these days. But what about the elderly patients? Those who cannot withstand the surgery, they will have to opt for sphincterotomy. So in sphincterotomy, you can provide the relief to the symptoms by providing drainage and relieving the obstruction. So this was all about gallstones. Hope you will find this video useful, and stay tuned to sqadia.com for more.